Good, are we ready to start? Good. Welcome finally to FABx, the global gathering of the Fab Lab Network. As you know, or you may know, the Fab Labs have been doubling roughly every year and a half. There's a few thousand now. Once a year, this network gathers, one of the most important things we do. We were to be in Canada this year. A pandemic intervened. We hope to return to Canada next year. This is FABxLive. It's a global online gathering. It's an experiment. And like many large events, we expect will end up changed by this, that in the future, it's always going to be blended. We're going to have a focal location, but we'll have a strong online and distributed component. And so this is a grand experiment in taking this intense personal thing we've done for many years and doing it this way. I'd like to start by thanking Narella, Anastasia, Fran, Rebecca, Sherry, Sarah, the many people who made this possible. I bow down before you for this just amazing labor of love, incredible effort to pull this together. I can say this. I did an event recently with a high-profile production team that was a train wreck. So far, this has been organized beautifully. Just the AV mechanics. So the pandemic has been an unprecedented challenge, but noting all of the loss, it's also accelerated the future. It's pushed us to address now things we saw much further in the future. So the whole week is organized to explore the role of the Fab Lab Network in the response and in, crucially, the recovery. And so we're going to progress. Today is explicitly on COVID. Tomorrow is going to be about building community. The day after about rebooting economies. The day after about the future of society, how we function. And then Friday, we end with a day of making and a celebration of Fab Academy and Academeni. You'll hear more. Each day we start with these topics, and then there's a structure you'll hear about later in the morning. And you can see on the site of what's new with the network, hearing from projects and partners, and then workshops. So turning to today's topic, once the pandemic hit, I started coordinating regular working meetings to develop and deploy responses, rapid prototyping responses. Those had a really brisk 5-minute pace to quickly get updates on topics. There was so much to cover. And in today's session, I chose to do that again. So we're going to get 5-minute updates from people who could and should fill an hour, but I don't want to leave any of them out. And so the goal of this session is to tour the range of responses across the spectrum we'll see. And so don't think of this as a complete presentation. Think of this as a humanly annotated table of contents. And each of the things you're going to hear about is very well documented to follow up. And part of the intention is to follow up. So the workflow is going to be tight 5-minute per person schedule. I'll be the good cop and the bad cop to intervene for timekeeping. In the YouTube post questions, we'll feed them into this conference, and I'll pull out questions when there's time with the Q&A. And I also encourage all of you presenting to ask questions of each other. This is really a dream team. It's a remarkable group of people who have made time and availability to participate this morning. And so with that introduction, I'll keep myself on schedule. And we wanted to have the first talk look at the basic science. So Pranam, who's is a student who's been working in CBA, doing really striking work on the molecular basis and response of COVID. So Pranam, take over from one of the CBA biolabs.
Hi, everyone. Can you hear me? I'm going to share my screen quickly. Wonderful.
Audio, video, and screen are good.
Awesome. Thank you so much, Neil, for that very nice introduction. So today I'm here in the lab, and I'm going to talk to you a little bit about what we have done to build a SARS-CoV-2 therapeutic here in the lab via molecular rapid prototyping. So I think you all are familiar with the developments of vaccines and therapeutics. Clearly, we're have a huge need for vaccines to come, but we're also developing therapeutic drugs for patients that already have COVID-19. And a lot of these drugs that you hear about are due to the mechanism of the COVID virus. Essentially, at its core, the virus infects cells by binding to an ACE2 receptor on the human cells via this interaction. And that's the ability of the virus to enter the cells through this pathway. Now, recently there was a method to be able to use this receptor to bind to the virus to prevent it from infecting the cell. And so, and this was recently published, but this therapeutic platform is not optimal because it's too big. It has its own function that it has to still carry out, and it can bind to molecules that are not the COVID virus. And so for a therapeutic, you want something very specific and very active. And so we in the lab have developed a computational pipeline to identify small protein sequences that can bind the virus really strongly. And here are some of the candidates that our computational pipeline has generated. As you can see here, they're much shorter and smaller than the original therapeutic that has been developed. And so the idea is for this small protein to be able to bind the virus so that it cannot enter the cell. Also not bind off-target molecules that have other important functions, and bind viruses if they mutate to a different sequence, so that if they mutate, we'll still be able to catch them. But the question is, what if the virus still infects, right? Well, you could use something maybe like CRISPR, right? You may have heard of CRISPR, the ability to cut up DNA or RNA, and the virus is made using RNA. And so you could use CRISPR to chop up all the viral RNA. CRISPR is our thing. This is what we do in the lab. We rapidly prototype and build proteins that do gene editing. So this is our expertise. And if you want to take a look more at our work, this is what we do and build new, better CRISPR enzymes for purposes like this. But that's already been done. CRISPR has already been evaluated as an antiviral strategy. It's probably not the best way to go here. So our idea was that if we have a protein that already binds the virus, we can link it to something that'll essentially degrade that virus in the cell. And these are called E3 ubiquitin ligases. I won't go through the chemistry, but they're really useful for degrading proteins such as and viruses as well. And so we established a method that would allow us to degrade the virus. And we even optimized this platform such that when we first tested it, we saw that our peptide, our small protein, inhibited and destroyed about 20% of the virus. But to improve that, we did a complete scan in computation space to see what can make this better. And we identified one variant, one mutation in the peptide that allowed us to achieve over 50% degradation of the virus. This is work that is up on the bioRxiv that if you want to take a look at it. It's also been published in MIT News, so you can read a lot about our work too. And our therapeutic is really useful because it's small, so it's easy to deliver, unlike CRISPR. It's made up of completely human parts, so it has a lower risk for immunogenicity. Your immune system won't attack the therapeutic, as well as it acts as a Swiss Army knife, because you can imagine that even if you can block this virus from entering, if you can't, and you have this attachment to the peptide, we can immediately tag the virus for degradation once it enters. We've done some viral testing on this work, and we've shown that in normal setting, if you make the virus, it'll still be able to infect and turn the cell green in this case. But if you add our system, that can prevent that green fluorescence from occurring, showing that we've inhibited infection. Our work shows that we've inhibited infection by over 50%. And we're now entering non-human primate studies in China to test whether our therapeutic can actually be relevant in mammals, as well as monkeys, and maybe eventually humans. So thank you so much.
Pranam, what was the timescale from concept to testing?
Yeah, we started this in the beginning of April. We've developed all the computational pipelines, the experimental pipelines. We've gotten it to work in viruses and human cells, and now we're going into monkeys. So in just like 3-4 months, maybe even less, we've engineered and developed this whole pipeline.
So that's what I wanted to underscore. It's really molecular rapid prototyping on the scale of fabricating a physical object. It's this whole sequence of molecular development, getting at the real fundamental root of the pandemic. Thank you, Pranam.
Yep.
So the next group is PPE has been a big topic in rapid prototyping, and it's ranged from DIY to mass production and ranged from urgent to ineffective to dangerous even. And so we found a real need to help drain that swamp that mixes fairly basic research with very applied application. And so this next group is a tour through one of those arcs and about face shields, one of the most popular projects. And so first, Jonathan from Simulia will talk about computational fluid dynamics and modeling and lessons from that. Jonathan?
Thank you, Neil. So the Simulia team was introduced to Neil's team by the 3D Experience Lab, as they were running a very active open COVID community for the makers. This is for startups and experts to share their innovations and designs from across the world. So after introducing us, myself and Grace started working on some masks, and later on I'll show some results that were produced by Eric. So the first simulation that we did for the was a sneezing simulation, so you can kind of hopefully see it here. Doesn't seem to be playing very well. So you can see that the sneeze progresses, and you can see how it hits the PPE. And we use this then to look at different designs for PPE. So this is a study that was done by Grace, and here we're isolating only the particles that make it kind of in behind the mask into the region where they might be dangerous to the person. And you can kind of see how these different designs with different visors at the tops and different lengths can change how the virus molecules might be able to get in behind. And this told us that we should extend the visor a little bit lower if possible, and also to pull the sides in tight, as well as having the shield over the top. So the next kind of project that we start working on was one with Eric. This is looking at Zach's isolation unit or incubation box. I think he's going to talk about that in a second, but basically the idea is that we wanted to help protect the doctors while they're introducing the tubes into the patients. And this isn't necessarily the best design for keeping the virus inside the box, but it also takes into consideration feedback for how easy it is to get your hands in here and do what you have to do. So and then we also did another one where this was more of an isolation box. So the idea here is that you want to be able to use other types of devices that might introduce aerosols into the space, but you don't want to have to put this person into an isolation room because that's kind of limited availability. So here we introduce a vacuum at the back, and you can kind of keep the aerosols inside the space, allowing us to have more flexibility for treatments. So with that, I'd like to pass it over to Zach.
Great. So again, Jonathan is from Simulia. He and they are experts in computational modeling. And so this is computational fluid dynamics that help underscore the need to seal sides of the shields for when higher protection is needed. So then we're going to go to two students in the CBA shop, Zach and Alfonso, who went through a number of generations of iterating based on that work. So Zach and Alfonso, take over. We're not getting audio. We're not getting audio.
Can you hear me now?
Yes, go ahead, Alfonso.
Hi, everyone. This is Alfonso from CBA. I'm a researcher here at CBA, and I want to talk to you about the folded solutions we have been offering through this COVID response. First of all, to put you a little bit into a fast context, Since COVID started, we saw how all the maker community start to propose a lot of solutions, most of them based on 3D printing, or not that easy to scale into a high level of number of units. And also in a parallel way, SAC saw how Dr. Yung Lei offered as a proposal of design this COVID isolation box in which the patient could be inside. These are two designs we proposed to the doctors, which were based on designing, optimize it to be reproduced with minimal equipment to all the Fab community. After having a round of feedback and having like a designing is a loop, we were told that the doctors told us that they were interested in something who were like completely transparent, that having no sharp edges, that have no worrying gaps. So we start thinking about if we're able to design as something foldable, and we make like this first attempt, in which after again like some meetings with some collaborator, as Marty Culpepper like suggests us like, why don't you make a cylindrical tube catenary or whatever, and we thought what's the mixture between both worlds is like corp creasing. So we propose a corp crease design, and the really important part of this design is like the corp creasing provides a lot of structural integrity to the solution, because the aspect ratio of the structure based on the thin is a shell structure we were proposing. We really need to rigidize because the box will be over a patient, and you really need like that stiffness. Also, we made like some access to the doctor's hands. And again, as designing is a loop, after a round of feedback, a round of iteration and everything, we went to the final version 14, in which we get like the proper altitude, the proper location of the holes. And as you can see here, all of this came basically from a flat design that we are making in our shop here in our machine in the Zoom. Also, as a proof of the structural integrity that the core crease are providing, like this box was able to stand almost 10 pounds of weight. And keeping the momentum of the design flow we were following of proposing folding solution, which we thought it was, we were having much less manufacturing time. We were using one or two materials, and it was so easy to industrialize. We proposed as well to the Fab community this folding solution of the shield.
So Alfonso, we need to watch time. Are you going to do a live demo?
Yeah. So I will stop sharing, and Zach will record.
So we're still in the same room. Mute your Alfonso, mute your computer.
Yeah, he's muted. Go ahead, Zach. So Zach, explain what you're showing. Zach, what are we seeing? So I'm not sure if Zach can hear me, but he's showing the Zun, this gorgeous few $100,000 driven cutting tool, cutting out a curved crease folded shield. So this is taking the math of curved crease folding, taking the simulia, and making this shield with no extra parts that folds on all sides. Zach, can you hear me?
Yep, I can hear you.
Okay. So that was Zach on the $200,000 tool. Then to help deploy it, he's going to the $20,000 tool, the ShopBot.
Yeah, let me just change devices real quick. Did that work? Excellent. Okay.
See, right now we see your feet.
Oh, yeah. Sorry. You need to switch over to the other. There you go. You need to switch over to my other camera.
We switched over. Good, Zach.
Excellent.
So the normal transition is you either make this on the $200,000 machine or go to die cutting, but Zach started looking at the ubiquitous large format CNC. So go ahead, Zach.
Yeah, so the basic idea is that laser cutting is not ideal for face shield material because it tends to produce a burn smell. The doctors that we talked to didn't really like that. Most people don't have a $200,000 Zunes, and die cutting takes time and money to spin up. So this is an alternative method for Fab Labs to be able to do this type of fabrication. Essentially, you take a 1/8" single flute end mill designed for plastic. You secure your your PETG sheets under a big piece of HDPE. You make sure that your design has a sufficient internal radius. In this case, we want to be above 1/8 of an inch just so that we can get into all the details. And then you essentially sandwich a bunch of sheets of PETG under a piece of HDPE to your MDF spoil board that you have on your machine. So a couple of tricks that I learned along the way. You can cut these little paddles and use them as indexing devices for your spoil board. And then just
Sorry, Zach, we're running a little
long.
long. Don't worry about tricks. Let's just get to showing like how it works, what it looks like.
Oh yeah. So this is the end result, an interlocking tab that holds together Alfonso's mask design. And this is the 19th sheet on a stack of 20. So you can see the edge cut detail is as good as, if not better than, laser cutting. And when you do the math with a couple of process optimizations, you can get to 80 shields per hour with a team of 2 people. And that's using full 4x8 sheets. So I think it's a really viable way for Fab Labs to be able to mass produce these types of shields.
For people not familiar, can you show the shot bot behind you?
Oh yeah. Yeah, so this is a shot bot. This is a 5x10. It's just got a router on the bottom with a collet. Looks like it's got a bit in it still. It's on a 5x10 foot gantry, and it sits on top of this MDF spoil board. You can just use drywall screws to secure material down to this. And then dust gets extracted through this hose into the dust collector.
Okay, good. Thank you, Zach. And so from Jonathan's simulation to the curve crease folding to wrap around all sides to the quick turn batch fabrication process development. Then for testing, we started collaborating with a group at Boston Medical Center. It's been a great collaboration in providing feedback in a really interesting setting. So Willie, Zaid, Stephanie, can you take over?
So, hi, I'm Zaid Altawil. We are emergency physicians at Boston Medical Center, and we are team leads for the innovation team at BMC.
Hi, I'm Willie Baker, and of course, I'm also at Boston Medical Center, and I'm the Vice Chair of Quality and Safety for the Emergency Department.
Hi, I'm Stephanie Stapleton. I'm also a Director of Emergency Medicine Simulation at BMC.
Let me tell you a little bit about Boston Medical Center. So we're a large teaching hospital, but we're very different than most teaching hospitals. About 50% of our patients are in the low income category. We are a safety net hospital. Now, to contrast that, most teaching hospitals in America have about 19% of their patient population as low income. And about 80% of our patients' care are paid for by some form of government insurance. We also have a very busy emergency department. We're one of the top 10 busiest in the country. Now, when COVID hit us and the surge came to Boston with a really very steep exponential increase curve, we, like many hospitals, really hadn't seen it before. I've been practicing emergency medicine since 1990, and I've never seen anything like this. The sheer number of very sick patients with respiratory illness was overwhelming. And as mentioned, we put a lot of patients on ventilators. We had about almost 1,500 discharges of COVID patients from BMC, and about 22% of those were in an ICU, a lot of them intubated, meaning breathing tube put in and under mechanical ventilation. We have a graph that demonstrates this surge. The yellow on the rest were before COVID. The black line is when Massachusetts declared an emergency. And all that red were patients who were COVID positive. So this was 2-3 times the number of intubations on a daily basis. And with that came fear for us as healthcare providers. There's a lot of unknown, a lot of fear of infection transmission to healthcare workers. That was the experience with COVID-1, with SARS. And we were worried for our safety and our ability to provide good care and possibly even bring this home. So the rigid boxes that what Alfonso described, we tried those and we had concerns. They were very heavy. We worried about the safety of the patients falling over and safety of staff. They weren't that durable. We actually had one shatter. And we also had infection control concerns because you had to wipe it down and there are nooks and crannies and crevices. And then there were some serious usability issues.
So the challenges brought on by the COVID-19 pandemic, as well as the lack of these finely tuned solutions, is what really spurred the relationship between us at BMC and the Center for Bits and Atoms. Through the rapid prototyping and iterations, we were able to test over 14 generations of this design, leading to the mentioned improvements in terms of visibility, usability, safety for both the patient and the provider, as well as ease of assembly and disposal. The real key, though, behind this relationship is this was all tested in a high fidelity simulated environment by real frontline healthcare workers.
So here we are at Boston Medical Center's Medical Simulation Lab. What is medical simulation? Well, it's something that we've adapted from the airline industry. You've heard how pilots will actually practice their skills in a flight simulator before they fly us around the globe, which is something, of course, we appreciate very much. It's similar to that. So we actually, healthcare workers, frontline workers, we all practice our skills before and in between patient care so that we can maximize patient safety and treat them with the best of our abilities. So what is a simulation lab? It starts off with having a patient. Here we have Mr. Mannequin. He can actually breathe. He can beat heart. He actually responds to any questions or interventions any healthcare workers might do. He can even vomit if need be. We also have a crash cart, a monitor, we have oxygen, we have medication, intubation equipment, anything you might need, just like a real hospital room.
Now, the real key as well in our partnership, in addition to the high fidelity simulation environment, is that it brought the end user, in this case, frontline healthcare workers, closer to the designers and fabricators, incorporating real-time feedback in order to result in a more finely tuned, well-designed product.
Next steps is we're going to bring this actually into the hospital to use on live patients to perform a usability assessment. So live patients, real staff who to date have not been involved in the whole design process. And we're going to monitor how and interview them on how their experience was with the intubation box, optimize it further. And furthermore, we look forward to future collaborations with others on other products and other advanced technologies.
Thank you.
Oops. Sorry, excuse me, I was muted. Had you ever done a collaboration like that before? Sorry, you're muted, Zaid. Go ahead, now you're unmuted, good.
So yeah, we had never done this before. This is completely new to us, and we're very grateful for you guys getting involved in working with us, and it's really sparked a lot of interest from other providers in our hospital. And there are hidden makers and engineers amongst us. One of the pulmonologists that actually, he's a little older than me, which is kind of old, and he actually worked for NASA before he became a doctor. And he still tinkers, and he goes and he works in a Toyota dealership because he loves cars, sometimes just for fun. And there are other people with similar interests in innovation in our hospital.
Also say the next generation, the medical students are quite interested and bring a lot of skills to this as well. So this has helped us continue to grow innovation and sort of linking design skills to medical schools and students in the next generation of physicians.
So yeah, this has been one of the striking themes is we really didn't know about Boston Medical Center. They didn't know about CBA. We didn't know about Jonathan, how these collaborations have been driven. A question from YouTube, was it a challenge to divert doctors' time and attention to get them to pay attention to this? Talk about the institutional integration.
So I can answer that. I think one of the challenges was because it was both in the novelty of the COVID-19 pandemic as well as the rapid time course where everything took place. So it did take I mean, doctors in general are somewhat flexible and learn how to adapt to new circumstances. So there was a bit of a learning curve, but in time, the institution as a whole really mobilized towards making more, or at least taking more effective steps in facing this pandemic.
So our institution, as mentioned, the Safety Net Hospital, they're really focused on the ball. The name of the game is to take care of the patients. And we don't have a lot of resources to devote to other stuff. We can't be a kind of, there are the hospitals with innovation centers, and most of them are designed for commercializing things. This came out of a need. So we needed PPE, we had problems that we needed solved. So the institution really took interest in that.
And what about regulatory issues for this kind of prototyping in bringing it into the hospital?
So this is where the strength of the simulation came into play. By having this intermediary zone between the fabrication space and the clinical space, in the middle having the simulation lab allowed us to sort of deal with, I wouldn't say a gray area, but a safe area of a lack of clear-cut regulation.
Just to add to that, I can sort of say it's the ultimate beta testing area, and that's how I encourage everyone to learn and use it as well. So if, for instance, with all of these boxes, we would bring in residents and respiratory therapy and have them do everything just like they would normally do, but without the risk of hurting any patients or having to involve FDA or anything like that. And by that method, we can get that rapid feedback.
Okay, that's great. So summarizing current state, the folded shield design is done. It's open, it's vetted, it's ready for reproducing. The protection box is currently going through the pipeline. Okay, thanks, Stephanie, Willie, Zaid. One other just quick question I'll comment on, then we'll go on. There was a question to Pranam about, can you make paraphrasing what he showed in a Fab Lab? The answer is no. You need a bio lab, but the answer that is yes is how to make almost anything that spawned Fab Academy led to how to grow almost anything that spawned Bio Academy. Bio Academy roughly is how you use a Fab Lab to make a bio lab to then do biotechnology. With that great power comes great risk, and that's a big part of Bio Academy. But if you're really interested in Pranam's work, the path to it from a Fab Lab is through Bio Academy and how to grow almost anything. Okay. So with that, we're now going to turn from that arc of that project to a number of companies had to rapidly pivot, both to respond to the pandemic and just for the company to survive. And so I'm delighted to go to Josef Prusa, who's his shirt observes many people are makers, but not many are machines. And so he's the machine behind me. So Josef, take over.
Hello, everyone. Can you hear me? Thank you. Thank you for having me here. It's an honor. Unfortunately, we don't have much time, so I will try to be very brief. So we are one of the largest 3D printer manufacturers in the world. And what we use to our advantage in this time is that we have the largest 3D printing farm on the planet. And that counts basically 600 printers. So we knew when the situation actually got bad that we are willing to allocate the capacity to make something which helps. So after a little seeing what the community was doing, they were mostly printing respirators, which after a very short, brief period, I found out that it's not very safe, especially in the DIY setting, if you are making just few at home and you don't have the quality assurance. So we were looking for other designs, and we found out that the best and the safest way to make for people at home, for DIYers, is to do face shields. And we ended up making Prusa face shield, and we got it into production in 3 days. Basically, when we had the design done, it was pretty quick because the team was ready. And in the first day, I got in touch with the Czech Minister of Health. So we wanted to have the design vetted and tested, and we got to the frontline workers. What was very important is that it needs to be compatible with the other protective equipment, which is indirect venting goggles and the respirators, and there are different sizes. So there needs to be a pretty big gap. And also, maybe quite contrary to other research, mostly everyone wanted the top open because it prevents the fogging of the goggles, and the goggles are protecting the rest of the face. But I guess for the like grocery shopping, where they don't want to wear goggles, it is much better. So now I will try to do some screen sharing and show you some of the resources we put out, because let me see. All right. So this is where you can download the face shield. This version is the final one. This one went through the European certification, and we actually put out an article. Here, how to get a certification for personal protective equipment in European Union. And you can use this as a guide. It should work for other things, not just the face shield. And for the companies which are willing to make the design, we offer that they can use the certification we already paid for, because it's a quite long process. Another thing which is very useful, which spawned out of our face shield project, was that we got some labs to test the disinfection methods for 3D printed parts, because obviously you want the shields to be reusable. So we've done the test with the live COVID, and we covered a lot of methods, because around the world or around the different places where people are using it, it might have something else available. So you can use this. It should be working for other stuff which is 3D printed. And if I'm correct, this is the first time this was done for DIY or hobby setting 3D printers. So after a period of 3 months, we actually managed to deliver or donate. We didn't get paid for it, unfortunately. Almost 250,000 face shields, but through the network of volunteers and some companies, we were able to deliver basically everywhere, contrary to our government, which supplied only the hospitals, but we did the senior houses and stuff. Basically, you can see that map on the website. So all this.
1 minute, Joseph.
Oh, 1 minute. All right. So you can get all this stuff on the prushaprinters.org. It is on the front page or on the blog. And there's also a good thing with the timeline and all the information on one site at prusa3d.com/COVID-19. And also, we managed to stay open during the whole time. We didn't have to go to quarantine thanks to our measures, which we also put out for others to see. So you can find them on the blog, how to prevent the spreading inside the company and stay open in these times and keep your people safe. I think that's it. Thank you.
And Joseph, I've been really struck throughout at the transparency, how every step of everything you've done openly and shared and propagated.
Yeah, thank you. I'm a big propagator of open hardware. So I think, especially in this time, it is very, very needed. We published the shields as open source, of course. We did it under non-commercial license because I really didn't want people exploiting the pandemic. So it seems that it turned out well, and a lot of the companies, including United Lunch Alliance, were printing our shields, which I was very proud of.
For those not familiar, what he showed was the graphic for the open hardware initiative. Okay, let's go on now. Another printer company that rapidly pivoted is Formlabs. Max, can you take over?
Sure. Yeah, my name is Maxim Lobovsky, and I'm co-founder and CEO of Formlabs. And I was a student in Neil's lab 10 years or so ago. So Formlabs makes professional desktop 3D printers like these ones behind me. And, you know, like everyone at the start of COVID, we were trying to figure out how we could help. And we pretty quickly found a few applications, the biggest one being printing test swabs. I'm just going to quickly share my screen to flip over to some stuff. Can you see my browser here?
Not yet.
Just gotta hit that, and now you should be able to see it.
Got it.
Yep. So it's kind of a web page where we go through different applications. There were, parts for masks and ventilator adapters and face shields and all that. But the big thing were these test swabs. So we had a couple of our customers were research hospitals that were also working on applications for 3D printing. And USF, University of South Florida, and Northwell Health in New York State, they found that you can 3D print test swabs. So they're these long things that you stick in your nose and pick up a sample, and they're normally made with this sort of like a special fibrous tip that's glued onto a plastic stick, and it's kind of a rare thing that's only produced in a few locations in the world, and there was a big shortage. So we worked with them to refine the design, went through a variety of safety and efficacy testing, and by early April or so, we had something that we could ship to that both our customers and we could produce and ship to people all over the world. Fast forward to today, we produced more than 500,000 in our own facility, and our customers have produced, we don't know exactly, but 3 or 4 million more around the world.
Max, fill in a little bit more on that, on both the iteration to develop it and then the scaling to produce it.
Yeah, so it was really intense, crazy period, because we were trying to get the stuff out there as soon as possible. But we also, we have experience with medical device manufacturing because some of our materials are certified as medical devices, but nothing like this. So we had to get up to speed rapidly, working with those different universities that we're collaborating with, sending them iterations of the design back and forth, and trying to figure out what testing we even needed to do. And then ramping up production was a big challenge too, because you want to, to produce enough of these, you need to really get the cost way down. The conventional ones are available for something like 50 cents each. And that's tough to hit with any sort of labor-intensive 3D printing process. So actually, I'll switch to this video, see how well it plays for you. But this is a tour of our Massachusetts, our facility in our office here, where we're producing swabs, although the main one we produced was in Ohio. You can see, I'm not sure I show it in here, but there's various like jigs and things like that to support the process. This facility is set up for producing about 50,000 per day. Another big thing we worked on, we were trying to make a big federal purchase happen to supply the federal government with millions and millions. And we went deep into working with the FDA and federal procurement process, which was a new thing for me. Fortunately, that one didn't go through. But another thing I'll say that's pretty interesting is the demand in the US went away by sometime in May, but it continued in other places in the world to this day, especially smaller countries. So like we have customers in Canada and then Singapore that are producing in high volume now. And I think the reason for that, I'll just switch back to my face over here.
Max, 1 minute.
So I think the reason for that is those small countries, during the peak of the kind of the chaos, all countries were sort of nationalizing anything that was in their borders. So small countries that still don't have conventional swab production are really interested in having their own independent sort of distributed production capabilities.
Good, and yeah, I think that was the received wisdom is you had to go to injection molding in volume. I think this was an interesting case to doing sort of rapid prototyping at scale.
Yeah, one thing I learned, I think these parts can be made with injection molding, but because the design needed to be refined enough, we had to go through many iterations to get there, and we were definitely taking advantage of printing out new versions every day. The injection molding designs, as far as I know, people started working on them at a similar time, but they landed 6 or 8 weeks later as a result. And during the peak of the crisis, that was 6 or 8 weeks is a long time to wait.
Great. Okay, let's see, just a quick question coming in. How many swabs can a single machine produce in a day?
It's about 700.
Okay, good number. Okay, thank you, Max and Joseph. We're now going to go to Suchit from Dassault SolidWorks about a broader view at pivoting a large company. Go ahead, Suchit.
Okay, great. Can you guys hear me well?
Audio, video, good.
Okay, awesome. So, thank you everybody for inviting me here. And Joseph, I can vouch for your Prusa printer because this is my mask or the shield which we have produced, and for our local community in Acton, where I live in Massachusetts, we did thousands of these we use Prusa printers, Sindo printers, and others. I had like 7 of them running in my home for doing it. So thank you for making your designs available, etc. Let me explain.
Can you describe your role, and also do you want to take over the screen share?
Sure. Let me do the screen share. Let me know if you guys see my screen as soon as you see it.
And then we see your screen. Your video turned off. See if you can turn it back on again also.
Yes.
Good.
Okay.
Go ahead.
Is that good?
Yep. Go ahead.
Okay. So yes, I'm Vice President of Strategy and Business Development at SolidWorks within Dassault Systems. And if you're familiar with Dassault Systems and SolidWorks, we provide design software for designing all these kinds of masks and ventilators and everything, which became sort of a crisis call during the COVID. So as a company, as Neil asked, I mean, at a company, we have got this design software. So very quickly, let me see if. So very quickly, we started with this open COVID community. We have this new thing called 3D Experience Platform. And the idea here is we can connect all the engineers. So it's kind of like Facebook, but think of it for engineers where people can actually interact and work together, showcase their designs, etc. Let me actually go and show you very quickly live. I'll bring it up here. You guys probably can see it. So this is a open COVID community. Anybody can join in. There are over 300 members right now. And as you can see, there's a lot of discussions and projects from masks to 3D printed swab. We just heard from Max about them, or head support for ICU, etc. So the whole idea was connect people all across the world. They can discuss their projects, and not just in kind of typing ways, but also can share their 3D designs, etc. There were over 150 projects in here. Let me talk about. Let's see. This thing is not moving ahead. Yeah, it's a little slower. So here are some examples of, we had, as I mentioned, Dassault Systems SolidWorks is a software design companies. So we got calls from a lot of teams and teams which kind of formed together, not one company, but people coming from various places, even various countries coming together and asking for software help. So we provided actually free software for a lot of these organizations. Some of the examples are listed up here, from all the way from Turkey to Spain, Portugal, all across the world. One interesting example, which I personally took an interest in, was actually Neil started by Matt Kearney on this mask project, the N95 alternative face mask project, where initially it started with the Helpful Engineers organization. A lot of engineers came together, and in particular, of course, SolidWorks and 3D Experience Platform was used for design and collaborate, because there were different engineers from all these different places. But also we use the simulation software. So Jonathan, which is part of Dassault Systems, you heard earlier, Similia, talking about some of the fluid flow analysis he had done. Here's an example of what we did with the about carbon dioxide in exhale cycle, and Meyer said these
Sorry, Suchit,
to be approved. They have approved results of those, so they help them during that process. Another very interesting example which came through, through the 3D Expense platform was work we did with Dr. Pankaj Marshia, who is a sleep apnea doctor. And out of the blue, he had given us a call. He was working with a bunch of MIT and Harvard students on an open project to convert a sleep apnea machine into an emergency ventilator. So here you see some of the 3D printed device. In fact, I was playing with it myself, and I've got these devices printed as well. And here you see a fluid flow analysis done on how the airflow, etc., was much better through these things. So in all, I could just simply say that Dassault Systems as a company, our goal is to provide the software so that people can do and innovate as they do, whether they are in their homes or anywhere across the world. And here are some pictures of a very quick journey. At the bottom, some stuff we did with Mass Robotics. Matt Kearney over there with his with his masks, and then a lot of our employees also, sort of took advantage of the software and the accessibility they had with 3D printer machines, etc., to help their local communities. Thank you.
Okay, thank you, Suchit. So now we're going to have to go on for time. There's been a false dichotomy of DIY one-off and then mass manufacturing. Mass manufacturing can do volume, but that can't respond quickly. DIY can respond quickly, but doesn't scale. The next group of talks have all been looking at how you take distributed low-rate production and coordinate that into high-rate collective response. So we'll start with Dan. Take over.
Hi, everybody. I'm Dan Meyer. Let me share the screen here. Okay.
And let me ask each of you to do quick intros for your own background.
Yes, I'll do that. So I have 3 minutes, correct, Neil?
5 minutes. Or sorry.
5 minutes.
Yeah, 5 minutes.
Okay. All right. We can keep it to 3. So we were just talking about redirecting companies, large companies, and I'm going to talk about redirecting makers in a regional area, Chicago. A little bit about my background. I'm a manufacturing technologist. I've been doing that for 30 years. And most recently, for the past 10 years, I've been working with the Museum of Science and Industry. So I have a lot of background in professional making. You can see here in the year 2000, I was already using a 3D printer. And then harder core fabrication technologies too. But basically, a manufacturing technologist optimizes traditional and new manufacturing technologies to produce more things for humans, basically. So I also run, in the past 10 years, 9 years, I've run the Museum of Science and Industry Chicago Fab Lab, which is a pretty high volume Fab Lab. You can see here in 2011, when I was hired, I was to increase the output of the lab. Basically, we measure that by people visiting, designing, and making things in that space. And it went from 900 people, and then in 2019, we surpassed 12,000 people designing and making things in the Fab Lab. That's my wonderful team there. Unfortunately, we lost some of them because of layoffs during COVID-19. So what do you do during COVID-19 when you're a manufacturing technologist and a Fab Lab manager and you're part of the maker and hacker scene in Chicago? Well, you start making face shield frames. This is a Swedish Covenant face shield frame. I started printing on my kind of Frankenstein Ordbot 3D printer that I had been building over the years. And I just made, a few of them at a time. And this design was approved by and iterated by one of the local hospitals. So that's the design I picked. Then I asked the museum, hey, we have a lot of 3D printers. Could we print more of these face shield frames? And they said yes. So we got the printers, me and my spouse, Gaddy, put them in my car. We fit as many as we could in my car. And I brought them here to a spare room in my apartment complex. The management here was nice enough to give me a spare room. They did it within 4 hours, actually. Then right away, I went to work at optimizing for these small printers because they weren't big enough to print the face shield frames, which this is an iteration of Josef Prusa's design, the Prusa face shield. So I made one that bends inward. And if you look at my video right now, you can see I basically just took the standard Swedish Covenant design and bent it inward. And then we used an oven to heat up the frame and then bend it outward. And except we did that in a stack, which was much more efficient to bend them all together in the stack. And right behind me, you can see a printer printing one of these right now. Then we got together. This is where the hacker scene really helped. All my hacker friends worked at various maker spaces, some of them some of the largest ones in the world. For example, Jeff Solon runs the Lane Tech Maker Lab. Lane Tech is one of the largest public schools in the world. It's huge.
Dan, 1 minute.
Okay. So we went ahead and started distributing those things around Chicago. You can see the production output here. This is 2,340 face shield frames made off of 14 printers in the background there. Then I started organizing and bagging them. We found that sending the stacks stacked together, these zip apart, actually prevented them from being damaged. And they would do we'd do non-contact pickup. And then we'd go out to the distributed nodes, which these are all the nodes across Chicago. All my production went to the south side of Chicago, where they weren't getting very many face shields. Here's one of my first face shields in use in the south side of Chicago. And then during this time, it was really helpful to have the information from MIT and the Fab Lab Network. So I'd use the multi-conference unit to see other Fab Labs making things and communicate with them. And that kind of helped in the early days to understand we were doing the right thing and making the right moves in Chicago. And I'd share that with our distributed manufacturing network. If you want to learn more about what we did and how to duplicate our mesh node network, the Illinois PP network, you can go to Make Magazine and look at Plan C, Chicago Shield, and you can read more about the details.
And there's a question in the chat about materials. The best way to answer is all the projects you're seeing are well documented online. I'll make as a homework assignment on the FABxLive site, we'll put together a list of links from today's session for follow-up. So let's go to 2 more regional responses. Roberto, take over.
Is it my moment?
Yes, it is your moment. Go ahead, Roberto.
I thought Cesar goes first. Okay.
No. Go ahead.
Just a moment. I want to show you one visual presentation. Can you watch it?
We see your screen.
Yeah. Okay. So nice to meet you, everyone. It's a pleasure to be here with so many people, great people. I'm Roberto. I've been working with social movements since 15 years ago. I've been working around the world, also helping some movements in the US and Turkey, Europe, Cyprus, Latin America, and in Spain. I was one of the coordinators of the Indignados movement. And at some point of the pandemic, some people, I was talking with some people like from the coordination of coronavirus makers. That was this maker social movement that started at the beginning of the pandemic. And we started to collaborate in the international area just to organize and coordinate all the groups of makers all around the world that had contact these people from Spain, asking for answers, asking for help to develop their own ventilators and respirators. My values are in the technology. I've been doing some programming since I'm 4 years. When I have 60 Amstrad 128K, I started programming, but I have been developing my skills in political science because that's what I think it's inside of me. And I wanted to talk to you about the International Maker Network. It is in Spanish. Some people have asked me before why an international organization or something like this, federation of organization, it's using Spanish to talk with the world. But I think that's kind of a realistic approach because most of the people working in this international network are coming from Spanish-talking countries. but also we share some values and organization with people from France, Scotland, New Zealand, and also I think we share values with some people in the US too. And this presentation, I want to talk about things we have already talked about here. This is a global production dashboard that the OSMS has been doing from since April. And here you can see that the United States of America made something like 8 million, including the industry, not only the makers movement, but the injection industry have made something like 8 million products for sanitary protection. Here in Spain, you can watch that we have made something like 2 million products to protect, in order to protect the people from the COVID-19. And if you compare the two numbers between the first one, that it's obviously the United States, and the third one, 2 million products, you can see what the power of the people can do here when they're coordinated and organized in a social movement without an industry backing them, just sharing and developing these kind of products because they want to protect the people who care about them. I know I'm going to talk about some values.
Sorry, Roberto, there's 1 minute left.
We have been doing, 1 minute left. Yeah, okay. I'm not going to say myself. I didn't want to talk about solidarity because I know when I talk about solidarity with the people of the US, I think about peace, but I'm talking about care about each other, learn not to teach, modify, to destroy, to create diversity, to reach the goals, enjoy in order to renew the same cycle. Those are the core values of our organization. And also something about philosophy and also engineering, that is methodology as a complement of technology. For instance, you have the democracy, you have a ballot, and you need some values to put that ballot inside of a box. And I wanted to remind the song, the Believe song of the Chemical Brothers. I think that's more necessary than ever. Like the people, you need to believe in something, because that's the energy that made all those sanitary products.
Okay, great. Thank you, Roberto. For time, we have to keep going. So Cesar, can you take over?
Yeah, thank you, Noah. Thank you. Thank you for the invite. I'm going to talk about organizing makers on a national level. So we are going to talk to the how did we organize in Spain. And by the beginning of the pandemic, before the lockdown here in Spain, we got this message every day, kind of in the media, like emergency response needs specialists, needs sedatives and ventilator not to collapse. So some people just on Twitter took this wave of, hey, let's develop this open source ventilator and launch a Telegram group with this very idea of, is it possible to create an open source ventilator that can be mass produced in a distributed way using 3D printers, because 3D printers seem to be the tool that was available to most people. So eventually the group grew mostly 1,000 members per day on the first weeks. And it's very interesting to see how all these groups organize. So the groups made available some kind of organization structure. And there was this large group with around 17,000 people that were willing to contribute and collaborate. And out of this group, it's impossible to develop something out of a group of 10,000 people working on something technical like a ventilator. So eventually some R&D groups just emerged and started like developing their own ideas. If there was a group for ventilator, but also face shields, but also all kind of masks, everything related to pandemic. One of the most interesting things that also happened at the same time was that the different regions in Spain organized themselves to supply parts for the ventilator. So they started creating local groups. So if we were to produce a ventilator, there would be people having the printers ready, the materials ready, and could be in touch with hospitals. one of the challenges on doing ventilators is that there were some previous ventilator like this design, the MIT ventilator design, that was designed around the avian flu era, but eventually avian flu didn't kind of spread as coronavirus. And one of the interesting things, this was a work that was done as part of a class on precision machine design. So it wasn't tested on hospitals. So when we presented this to doctors, they were like, this looks interesting, but it's not going to work for COVID-19. So one of the first things that happened is that a forum launched where we invited doctors and people in hospitals, people researching on what to do, what to get. And fortunately, we got some really interesting and prominent doctors like Pancho Cañizo that talked to other people in his hospital and said, what do we need now? So he put online open ventilator specs. This is what we need. So a lot of things just went like crazy. One of the first things and the most well-known in Spain is it's called Resistencia, from people from Asturias and Canarias. But the very idea that this could be done just sparked several teams. A lot of people wanted to create, and it's very interesting to see designs like this, where you see on the left-hand side a ventilator that could be done in a Fab Lab, and on the right-hand side, the one version that could be manufactured and in any kind of factory. So we are all the time talking about plan E, B, C. So the main idea is plan E, we can buy the ventilators. There's nothing else to do rather than just paying. The plan B is that we could boost companies in Spain to manufacture faster. And eventually the plan C is, if there's no other solution, DIY ventilators is the only way to go. Fortunately, this wasn't needed, so plan B kind of went further, and we have ventilators right now in Spain. But as a side effect, people in this production network were able to manufacture 14,000 face shields a day and delivering them to the hospital. That I think is very interesting. Another very interesting thing that happened is that a lot of companies, research centers, institutions said, if makers can do this, why can't we do this? So a lot of companies just push forward, and in the end, more than, I said 37, but it's mostly like around 40, 45 ventilator projects move forward, and we have the chance through Cotec Foundation, that is a foundation related to innovation in Spain, to put an open call with the actual people just certifying and verifying the product. So they were able to ask, what are the steps? What are you going to ask in terms of documentations? What do I need to try? So it was kind of very interesting to have this kind of open conversation. And this led to 7-8 models approved for clinical tests. So if we think about this organization and everything that happened, I think we have some challenges ahead. And one is, how do we track this ventilator performance over time? So if we get to a second wave or a new pandemic, we know which model should we choose. And I would also like to highlight the role of Fab Labs, because it was quite different depending on where they were located. So for example, small cities like León, Cuenca, or in this photo, Mallorca or Sant Cugat were kind of the epicenter for volunteers. It was the place where people just joined and produced this and distributed them on the regions, but in larger cities, it wasn't so prominent. And one of the questions we had in the group, we're discussing this, that I think it's quite inspiring, is maybe Fab Labs should be part of the National Emergency Response Network. This is a kind of an open question, but in some cases it has happened, and I think it has been highly beneficial for everyone involved.
So, Cesar, talk some more. There were, for example, way too many ventilator projects, and in many cases, ventilators weren't needed. You've done a good job of leading without official authority. Talk about how you're able to do that.
I think with this kind of emerging organization, it's more like trying to set bridges and try to get the different teams to be able to tackle the next steps. One of the first things we did was producing some kind of checklist, like this is what you are going to be asked for local authorities. And we were also trying to highlight good examples. There is one example in Catalonia, for example, called Suchit Jain, that went from just using scrap wood to create the first project to have this mass manufacture at a car company. They produced 500 with all the documentation. So it's more like trying to get these really good examples and say to other teams, oh, maybe next step you need to do is animal test. So maybe you need to get in touch with this doctor, or maybe you need to get in touch with a local hospital, or it was more like not trying to take control of the project, but mostly trying to push them to what we knew. And it also was like a collective learning experience, because most of the people involved were not either ventilator experts. So it was kind of learning together and sharing all the information in the open. I think that's one of the keys. Sharing
Yeah,
everything.
and I think that's a really important observation coming out of that, the notion this is a kind of a national resource, national facility to think about working that way. Just responding to one question in the chat, somebody asked about, can Fab Labs do PCR testing? PCR machines are one of the easiest projects for a Fab Lab to make, but what limits them is not the PCR machine, it's the reagents. Making the reagents is a harder but still possible Fab Lab project, but what limits that is the research of what reagents you make for it. And that's a really fundamental research project needing the sort of collaborations you see here. So with that, we're going to turn to a really complex set of issues that we've been bumping against, which is how thank you, Cesar and Roberto and Dan, complex set of issues about how governments and regulations relate to all of this. So let's start with Martina in Italy.
Yes, hello, thanks, Neil. Can you see my screen?
Yep, everything's good.
Great. Indeed, I'm going to talk a bit about what is our experience in Italy. And as many of you might know, we had a lot of issues with regulation and a lot of bureaucracy here, and this also prevented innovation from going into the hospitals. And the first story I want to talk about is the Venturi valves. I guess some of you have seen in the international news the story about these valves. In short, what happened was that a hospital in Brescia, which was one of the worst hit regions in Italy, was running out of these valves, which are needed to mix oxygen and air for ventilators. And they were running out, and the producer of the valves was not able to provide those valves on time. So the hospital reached out to the makers community, and the company Isinova responded very quickly and was able to bring a 3D printer to the hospital, prototype the model, and test it over the weekend. So in a couple of days, these valves were ready to be used and replaced the old ones, and saved a lot of lives in the hospital. When it comes to regulation, these valves had to face serious regulatory issues because they could not be certified as a medical device. It takes on average 14 months at least to get a medical device certification in Europe. So what the hospital tried to do is to get approval by the government. And so to do that, a doctor has to vet for these valves and to ask formally the government to use those non-certified medical devices. And this request was always rejected by our government, systematically rejected. There was never an approval. So eventually, the company and the hospital used a sort of last resort thing, which was to make the patient sign a document which is called the document for compassionate use, in which the patient is taking all the responsibility for the malfunctioning of the product, and is basically signing that he is willing to take the responsibility for having a non-certified medical device. And I guess it's pretty obvious that this, from a legal standpoint, is not really a good way of moving forward, because you cannot ask a person that risks to die to sign something and to use something which is not certified. But this, we didn't encounter any issue with that because the valves were anyway always printed by a couple of companies with laser sintering. So there was not big safety concerns. Some concerns arrived when the Charlotte valve arrived. The same company which prototyped the Venturi valves were contacted by a doctor that suggested to transform a snorkeling mask into a protective equipment for non-invasive ventilation. And I have one of those here. I'm Fab Lab Messina, which made a lot of those. This is the simple valve. Basically, the company, they patented this valve, the Charlotte valve, but they also couldn't certify this because of the long time that we'll need to certify this. And what they did was that after they received thousands of requests from those valves from hospitals, they reached out to the Fab Labs and the makers community to be able to prototype, to make these valves very quickly locally. And also people just donated these masks locally. And there were a lot of calls from Fab Labs to make these kind of valves. And the first call for 500 of those valves was fulfilled in less than 24 hours in
Martina,
Brescia.
1 minute.
Yeah, but again, here the issues were this time 2 issues. First, safety issue, because no one was certifying the quality of those valves that were 3D printed by makers. And the second, again, was responsibility. For the safety issue, what happened is that the government, again, didn't help, but Fab Labs kind of self-organized so that some Fab Labs could certify the quality of valves before they were going to the hospitals. And from the responsibility standpoint, again, the government never was able to give a formal authorization. The requests were always rejected. So again, the compassionate use clause was used and patient always had to sign. And I just want to conclude by saying that the person that created these valves, which is Christian, this guy, after he gave thousands of valves to the hospitals and saved lives, he found out in his emails that there was an email by the government asking him to take down his website because it was considered to be a non-safe medical device. So that's how far our government got in preventing innovation coming from makers. Thank you.
Okay. Quite an arc. So next comes Alysia. Alysia is one of the leads in Materiome, which is looking at sustainable materials for Fab Labs. And while celebrating the maker response to the pandemic, there's this minor detail about what happens to all of this stuff. So Alysia, you're muted.
Hello, thanks Neil. So to begin, what I'm going to do is present about the COVID waste issue that has needing to be addressed increasingly and for the foreseeable future will become a feature of all of our lives due to the increase in volume. So there has been an abrupt collapse of supply chains, of waste management chains, so to speak, due to the COVID crisis. And that has to do with volume increase. For example, Wuhan saw from 40 to 50 tons a day go up to 247 tons in March, so massive increase. Pollution, so a lot of people are discarding single-use masks, for instance, and other protective equipment on beaches and in the surrounding environment. Mismanagement, so household waste is often needing to be dealt with differently because people are discarding PPE or at least protective equipment that they're wearing on a daily basis, like masks, etc., into their normal household waste, and that has been leading to a lot of mismanagement issues. And then finally, disease transmission. So there's, in a lot of parts of the world, the role of informal recyclers and waste management is huge in terms of dealing with waste in general. And transmission of disease through improper handling can happen when infectious items are mixed in. So the needs that need to be addressed on that basis, first of all, low-cost PPE disinfection and reuse. That means that from a Fab Lab perspective, there's a lot to be done there, and I'll talk a bit about that in the next slide. Secondly, responsive waste management. So for example, mobile waste treatment units. Third, an investment in local capacity. So this is where informal and small scale recycling, where it's a feature in many markets, needs to be more robust and invested in. And finally, design for product life cycles. So this is where a lot of Fab Lab intervention can take place on the basis of design for PPE, considering the whole system of waste management, from generation of the waste itself, collection, transport, recycling, or disinfection and reuse and disposal. So the whole system needs to be considered, and there's a lot of potential for innovation in that area. And this presentation, specifically on the innovation side as well, is an expression of a waste group that was put together recently in response, which contains the work of Nikhil Lal, Julia Hansen, Patricia Stathatu. And so together we've put together not only this kind of overview, but also some of a snapshot of potential interventions that could be done on behalf of or from a Fab Lab perspective. This is an impression, but it has it falls into three basic categories. Number one is increasing local tech capacity, so for sterilization and reuse. So when you sterilize and can therefore reuse PPE, it obviously avoids the waste that is at issue here. Secondly, material design and selection. So we need to design better material and select better materials that can be sterilized and reused instead of just designed for single use and disposal. And finally, we can also look at recycling and end of life when those materials or that PPE perhaps has defects, et cetera, and needs to be taken out of the medical supply chain, but actually dealt with appropriately through recycling. So here's just a snapshot of ideas that are being put forward to as kind of interventions in that area. From the local tech capacity side, ozone gas sterilization system. That's a picture from Lumosity Lab in Arizona, where a sterilization system was developed for clothing and PPE. Nikhil has actually developed a prototype in Artisans Asylum, which is an open source prototype that is he'd be really keen to collaborate on in terms of making that more replicable and adding people's ideas in various Fab Labs around the world. And then a second option is autoclaving. So this is where high pressure and steam can sterilize medical instruments and materials that have been infected with the virus. The picture on the lower right-hand side is a solar-powered autoclave that was published.
Alysia, 1 minute.
Yeah. Okay. And that also has an instructables. There's an instructables for an open source autoclave as well. So again, a local sterilization option. And along the lines of material selection, the autoclave shield, again developed by Nikhil, is a really good example of altering a face shield design in order to make it autoclavable. So this one is made of polypropylene and polycarbonate. Both materials can be autoclaved safely and therefore reused. So that's a good option for increasing or decreasing the waste from shield use. And finally, as an example of how Fab Labs can get involved in the recycling of materials like polypropylene and polycarbonate after end of life, the precious plastic shredder is an example of turning that into a potential feedstock for filament through the Filabot, et cetera, that can be used for making 3D printed filament from waste materials. But in all of this, there really needs to be more understanding of the sanitation of the materials involved and developing protocols to make it safe.
Okay, great. Thank you, Alysia. And then we're going to go to my brother, Joel Gershenfeld, who's a leader in labor and work and organization. And as he describes it, machines that make machines need organizations that make organizations. So go ahead, Joel. You're muted.
Sorry, how many times have we all done this? It's an honor to be sharing the screens with Martina and Alysia. As you'll see, the three of us, in a sense, combined to pose a challenge for the Fab community. I'm going to actually start with a book that was published a half-century ago by Robert Dahl. At the time, political scientists thought the US was only governed by a small number of elites. He looked at the city of New Haven and some key decisions and basically documented that decision-making was much more distributed than people thought. He basically documented that influence can drive decisions, not just authority. And that's the theme that I'd like to strike for these remarks. As you heard from both Alysia and Martina, issues of raw materials being medical grade, issues of regulations governing devices, and of course, issues of the vast number of PPEs being produced. And you can't go to a Fab Lab website and not find that it's done some project of one kind or another. And Martina points out that regulators had great difficulty even accepting that this could be done by others. And Alysia has pointed out that the PPE that's being produced creates massive waste issues. I'm going to add to it something we heard at the beginning of the talk, that biofab is now an industry sector. And of course, they're trying to reach biofab even to young kids. And all of this raises a set of regulatory issues that I'd like to talk about. This is using everyday language in terms of where we are at. There's a kind of progression from people not in the fab community saying they can't do that to can they do that? And now we're sort of at the are they doing that phase. And I put a little lightning rod because marker that the transition from are they doing that to can we do that to we do that, essentially becoming a rapid response capability in society, is not an easy transition. And I'd like to unpack that in a few ways. The first is, if the society were to say to Fab Labs, how do you govern yourself around risk? Basically what Fab Labs would say is something that Neil generated years ago. I had been working with industry around chartering new initiatives. And early on, we had a conversation in which we said Fab Labs ought to have a charter. So Neil wrote a charter. And the good news is it's lasted.
Sorry, just to confirm, the network wrote the charter. I just helped shepherd.
Okay. What emerged from the network as a charter is great. It has a lot of things that it clarifies and specifies. But in this pandemic, it doesn't specify safety of products and even working conditions and fair treatment in a Fab Lab, let alone, and I put just a small spattering of logos of governing regulatory entities that would have an interest in what a Fab Lab does. And of course, the connections from the Fab Lab community to any of these entities is happening, as we saw in piecemeal cases, but not in any systematic way. And
Joe,
so
1 minute.
the challenge that I'd like to leave you with as I wrap up is that institutions need to both create value and mitigate harm. The Australian Act is based on a 100-year study that I did on institutions of labor. And set against it on one side is Robert Michel, who argued that when you create something new, the first thing it does is it perpetuates itself, what he called the iron law of oligarchy. And you are all the oligarchs of the Fab community. Eller Ostrom documented different ways that people can come together and create new forms of governance. And so the challenge that I would pose is, how will the Fab community govern itself now that it's becoming an instrumental part of society rather than just a DIY Fab literacy kind of initiative? You're no longer just creating value, you are now mitigating harm, and that creates a higher standard in society.
And that's really the challenge for this session. It's pretty clear what we're doing is more important than just self-amusement. How do we organize? What follows? So with that, I'm going to go to the pandemic has really underscored vulnerability in supply chains. And we're going to look at a group of people looking at what do you do beyond limits in supply chains. And so first, we're going to go to Alex in Rwanda. And let me ask again, you're all remarkable, to introduce yourselves. So go ahead, Alex.
Thank you very much, Neil. Thank you everyone at Fab Lab and the network for the amazing work that you're doing. My name is Alex Ntale. I'm the CEO of ICT Chamber, and I also head the Rwanda Fab Lab. And we started a couple of years ago, 2016 to be precise. And the value that we have seen from being part of the network was, I think, came to the climax during this COVID-19 pandemic, where when Rwanda is a landlocked country, it's a small country, landlocked, and right at the beginning, around February, number of actions we have put in place, just trying to make sure that the leadership is taken care. And among those, one of the things that became clear was lockdown. Flights are done, and as cases began coming up, to date we have about 1,820 cases, 2 deaths, 900 recovered, over 800 that are still, almost 900 that are also in active. So Fab Lab went on to do research through the network, our Fab Lab, and three items have been, three designs to be specific. Face shields, there's been a lot of face shields that have been shared here, ventilators, and sanitizing tunnels. The collaboration, I've seen that Joel shared how governments are handling it, and also had Martina from Italy on how they embrace innovation, or how they are not embracing innovation. Lucky for us, that is different. We've seen the Ministry of Health coming up. We've got good partnership with them. The Food and Drug Authority, and other government agencies that have been very supportive. And through that, with the face shields, customizing them to context tier, we've supplied more than 6,800 to date, mostly in the to the frontliners in the health sector, but also now as we get ready for the opening of our airport, the airline industry, the hospitality industry, they're all coming up and getting face shields, or asking us to make them face shields, because as Neil said, the supply chains had been blocked. So I don't know how much time I have, but
0 minutes. So this is a time to wrap up.
Yeah. So what I can say is that there's quite a lot that we've generated or learned from the network, and we've made some few changes in the designs that we got, and we'll be also sharing those, including the ventilators, some work on the ventilator from our teams. And can't say how grateful I am enough again to the SolidWorks team, CBA, Fab Lab Network. It's really been very practical for us in Rwanda, and not just as a lab, but nationally. It has brought a new awakening on the role of Fab Labs. And as a result, we're seeing more interest in setting up Fab Labs in other parts of the country. So
Great,
thank you again.
And Rwanda's been a really interesting case with national leaders like Alex or Claudette, who really understand the network, but also in positions of authority of what does it look like to really do this as on national scale planning. So thank you, Alex. We're then going to go to Kenya, where Kamau and colleagues can talk about what they've been doing. Kamau.
Thank you very much. So as you heard, my name is Kamau Gashege. I run what's called Gearbox here in Nairobi. It came out of Fab Labs. We started a Fab Lab at the University of Nairobi, but we moved out especially because we didn't have enough freedom from bureaucracy. And so we have a separate space, which is probably better described as a product realization lab. And ever since COVID struck, we've had a number of innovations sprout, and we're really a platform that supports anybody who needs access to machines to be able to develop a prototype and demonstrate it. And we have a couple of projects. Can we share the screen? Is that?
If you can do it in 2 minutes.
All right. So we have a number of groups that are looking at very simple interventions such as hand washing, automated hand washing, hands-free hand washing machines, and they range from those that are mechanically operated by stepping on a paddle or having a sensor that you just put your hands in front of the faucet and the water runs out. Very much needed. Schools will be opening soon. There's a lot of orders coming up for such devices, very simple devices. We also have a number of groups. There's a Kenyatta University doing a ventilator, not related to us, but we are looking at our own ventilator project. This is using an amble bag, but there's one that's now using a canister as well instead to pressure on the pressure side of the air coming in to the chest, and that's almost done. And we also have Goge next to me over here, who will talk about some of the innovations that he's been working on very quickly. pulse oximeter. There's an oxygen concentrator which is being put together here. Some of the constraints on development have been sourcing materials such as the zeolite, which we recently got in. And so again, we're hoping to have the prototype complete fairly soon. And the pulse oximeter, as I said, Goge will quickly describe because he's put it together.
Great, 1 minute.
So my name is Goge, and this is the prototype that we have. This was our first prototype for the pulse oximeter. We just put in your finger and it gets both your pulse reading and your oxygen readings. And we came up with the second prototype where you put in your hand in 3D printed with our local machines and using Max 3102 sensor to get your readings. We have a number of prototypes that we're about to, we're still under testing, and we're yet to get the hospital approval so we can actually roll them out.
And so the other good piece of news is that we got a full SMT line sent over, and we have a joint venture to be able to make the circuitry necessary for all this. So this obviously will be important post-COVID for economic recovery, and it's an important step within the context of industrialization. Thanks very much, Neil, and it's good to see a lot of the faces that I know.
Great. Thank you, Kamau. Thank you, Gogi. And so for this group, we'll end with a former student, now I could say star, Manu.
Hey, everybody. Neil, can I share my screen?
Please do.
My name is Manu. I'm a faculty at Stanford. I have a tremendous fondness for the Fab Lab Network, and I'm just going to rapidly share what a couple of last months have looked like, at least for me and my lab. I'll start with a positive note. This is a cartoon that showed up in a French newspaper around some of our work on masks. Everything that I'm describing is primarily on our lab website, so you could go take a look. And then this is much more of an advertisement for many projects. Please write to me if you're interested in knowing more. All of this work is completely open. You can access, join, engage. So very briefly, one of the contexts that we've been working on has been all the way from PPE, and especially reusable PPE. At this point, we've deployed around 40,000 of these snorkel masks converted, 3 countries with regulatory approvals. I'll briefly describe an electricity-free COVID test that we've just released, looking at low-cost diagnostics. There is a very large team of ventilator design that I'll briefly describe called Pufferfish, which is really about providing a full-feature ICU ventilator to the world as compared to just the volume control, which has clinical factors to be considered. And then there is some amount of work on manufacturing of PPEs in terms of thinking about N95 factory in a box. So all this work is documented in papers and in websites, so you can find all of this. I'm just going to rapidly show you a few pictures. So one of the factors is this is all work done with large communities, and maybe if I get time, I can talk about what it was like to organize these groups as well. The first factor is clinicians. If you don't work with clinicians, it's very, very, very difficult to come up with something that's clinically valuable. So I think for us, it's been about almost 20 or so countries. We've had clinicians engaged in almost every single project. So on the ventilator front, although there are a gazillion open source ventilators out there, as far as I'm aware of, there is not even a single one that actually provides the ICU features. So there is volume control and pressure control, and both of them are important because lung in a COVID context is extremely delicate. So we built a team with 3 universities, several partners, to essentially build one of those ventilators that clinicians will actually want to use. We are in FDA EUA process right now. To the left is a schematic of what this ventilator looks like. To the right is the UI that a clinician would actually like to use. This is a quick video of earlier prototype of what it takes to build one of these. All of these plans are online. These are pressure-driven ventilators. They either operate on a compressor or an airline, but they have the classic features for volume control, pressure control, and assist modes. One of the values of working on this is to actually engage with clinicians. When you're designing, you're not thinking about features that a clinician will come back. So this is a cough test where the clinician is banging on the test lung to actually prove and disprove what happens when a patient coughs. And these are the kinds of moments and things from an engineering perspective when you think about, are you designing for the settings that will actually be used? So currently, Pufferfish stands as an international project. There are 3 manufacturing partners in India, Kenya, and Nepal. We are in the middle of an EUA process, but also 3 regulatory approvals in 3 different countries as well. And they have working prototypes breathing in their context. Briefly, NewMask is a recyclable snorkeling-based PPE that we designed, got through regulatory approvals in France and Belgium. This would be an equivalent of roughly around 4 million PPEs, primarily because this lasts for 3 to 4 months. There was a lot of work with companies like Boston Scientific. A lot of injection molding work was done, and a tremendous amount of regulatory work. But the joy of this is when you get to deploy tools around the world. I think there's roughly around 22 countries in which versions of these have been deployed. The last bit I want to mention is on COVID test. You all know that there is the need for tests, but one of the challenges is how do you get tests out in places and in settings where you're not in a primary hospital. So we got contacted by a group out of the Amazon where the COVID is still spreading in the Amazon communities. And we went back and designed essentially a COVID test that can be run electricity free. It's a lamp-based test, does not require anything other than just boiling water and what we call a handifuge. It's a type of a centrifuge that gets to the RPM, so you can do extractions of saliva. This is, again, all published at this point on medRxiv. Colorimetric-based test to perform COVID diagnostics.
Manu, what are the reagents for that? What are the inputs you need?
Yeah, the inputs is a key question. So I think one of the key inputs is from a LAMP perspective, or a class of enzymes. So we've been working with NEB, New England Biolabs, and they have ramped up their facility to get liters and liters of this accessible. At the point, the cost is roughly around $1 per test. And there is an equivalent version of this from another project in Vienna where there is an open source enzyme as well that's accessible. So one of the perspectives of this is we're actually also looking at this as one of the solutions for doing nucleic acid tests in the US when you're thinking about universities and schools opening up. So there is a tremendous amount of interest in home-based tests. So this is the direction that this is also going.
Great. 1 minute.
So I'll mention very briefly in the end on N95 manufacturing. So Neil mentioned to talk a little bit about supply chains. One of the challenges of the shortage of N95 is that there's no distributed manufacturing. So we looked at this problem and explored cotton candy machines, literally machines that are used to make cotton candy. We repurposed them, completely re-engineered the centrifugal melt blowing process to make. At this point, we can make N95 factory in a box. This is literally one of the plants. I can't show you the videos because this is in partnership with BIC. We are building essentially an entire N95 mask making facility all the way from manufacturing of the material and the mask in-house. And this is some of the data to really show that we can make tunable materials. So rather than you could choose whether you want to make an N95 or an N85 mask, for example. I'm going to end with the last bit, which is the value of information and misinformation. This is our work on decontamination. You can look at it at n95decon.org. This is a consortium that I helped put together 115 academics from around the world, where we really dived into the literature. Although you can see that step one of making something that could decontaminate is fairly feasible, but to make sure and scientifically prove that it's actually correct is a whole another matter. So we've been publishing reports on valid decontamination methods that are now used around the world, including by WHO, CDC's references this, and all of this is documented online. Let me just skip this and just get back to just this last picture.
0 minutes, so wrap up.
Yes. So I think the point that I want to make here is we all have COVID fatigue. It's a challenge. It's been running for a while. We would love for it to go away. The reality is the vaccine is not there yet. And yes, there are curves coming down and going up. So it's extremely important to stay engaged, contribute in regulatory framework that's accessible. And I think I can tell you the numbers coming out from India, I had calls last night, they're quite alarming. And one of the threads that anything and everything that you all can do would help some of the causes. I'll stop here.
Great, thank
you. That was the
Manu.
invention of the bicycle, by the way. That's my hope that we get to that when we are on the other side.
Great. And so that's a great transition. Pandemic fatigue is a really serious issue. It has to be sustainable for the people among many other ways economically. And so Danny and Lars have been both doing really interesting work about how that challenge becomes a feature, not a bug. So Danny, let's start with you. And again, start with intros to who you each are.
Yep, so my name is Danny Beesley.
Sorry, Danny, your audio is very low. Either bring up the level or just come closer.
All right, my name is Danny Beesley, and I'm based here in the Bay Area, and I've been developing Fab Labs here for about 10 years, and I also lead up the Fab City Oakland initiative here. Like everyone else, we kind of all went into overdrive to be responsive to develop PPE. We've produced over 150,000 face shields, 25,000 face masks. We used one of our college Fab Labs to build out the infrastructure for a factory for producing cloth face masks at scale. But you know, the primary reason why I'm talking about this stuff here is that we were kind of looking at unique models around how to sustain these efforts. And one thing, a partnership that I had in place previous to dealing with all of the PPE in the first place is that I had the relationship with a cooperative staffing agency. And what I was able to do in the process of raising funds for being responsive to COVID is bring on that cooperative staffing agency as the employer of record so that we could actually distribute funds directly to the individuals who were helping to support at least the key work. And now we're in process with the Workforce Development Board here in Oakland and talking about actually redeploying our mask factory in order to turn it into a workforce development program. But one of the things that we're positioning for is bringing the cooperative staffing agency directly into that relationship so that in the future, when we do workforce development programming, whether it be on PPE or others, that this cooperative staffing agency actually serve as the employer of record for those entering that program. In essence, anybody who starts workforce development training in relation to our Fab Lab efforts in any way that's coming through the official workforce funding starts off as a member of the cooperative just by nature of starting the training themselves. And therefore, instead of having an entity that is only concerned about getting a person in and then getting them out and moving on to the next person, you now have a direct financial incentive in place for that for those individuals to stay in that cooperative staffing agency. So there are people there that are actually trying to keep this keep the efforts going and keep the people working as well. And we're combining this with a textiles manufacturing lab that we're in process with, and actually in an hour I'm pitching the Autodesk Foundation for funding to support it, and then putting in a entrepreneurship overlay on top of it, so people come in, learn the basic skills, learn how to produce masks and other textile-based PPE, and then moving that on to other skills that you know other skills and products that will be more sustainable after COVID and after we're easing up from PPE itself. So we pulled together about 200 or so people from around the Bay Area in order to be responsive. And part of what we were doing is we centralized mass production, but then we outsourced all of our sewing to about 100 or so people at home with sewing machines, developed a delivery network system in order to move all the materials around. And then with face shields, we didn't produce those directly ourselves, but we essentially sourced the raw material, pulled in about 27 tons of sheet plastic that we received from Coca-Cola as a donation. and then move that out. Our first step was about 15,000 face shields in 48 hours. We were able to turn that around from the first load of plastic we got, which was about 5,000 pounds. That was followed up with another 45,000 pounds of plastic beyond
Danny,
that.
1 minute.
And then one other just interesting project that's coming out of this is that we've also kind of taken the access that we have to cheap plastic, and we're turning that into a $20 sneeze guard, since that's a new type of PPE that's needed. So we're using that same sheet plastic that we got tons and tons of, and now we've been able to develop a super low cost sneeze guard that we're getting cities here to fund the development of that, or not the development, but actually fund these units to go out into the community.
So Danny, quickly, can you just talk about the status of trying to create a worker-owned cooperative?
Sure. So we were lucky in that we already had a relationship. There's already a cooperative in place that was really structured very nicely to support all of this. So it was not extremely difficult because we essentially just signed a contract, or my foundation signed a contract with this cooperative staffing agency. But nobody expected any sustainability out of these efforts. And, you know, I'm trying as hard as I can to create some level of sustainability for people that are involved. So the difficulty is mostly just wrangling people and helping people understand that there is actually future opportunity for them here.
Great. Okay. Thank you, Danny. And then Danny's counterpart in Boston area is Lars. So Lars, take over.
Hey, good morning, everybody. Let's see, I'm looking for
Danny, if you stop share, Lars will take over the screen.
Thank you, Neil and everybody. It's a thrill to be joining you here. So I just want to kind of walk through the Artisans Asylum model. My name is Lars and I serve as the executive director. Joined the Fab Lab Network earlier this year, really when COVID hit, and we reached out to kind of some of the networks in the Boston region to understand what is the need and how can we help, basically. And certainly the Fab Lab Network has been a huge ally. So a couple of things just to sort of address what we've encountered as our journey and what's going to come next. You know, we did spend some time in these deep networks, and I think we're really enriched here because there is a deep academic network we can tap and learn from around product research, but also working with health providers, needed to understand what their needs were, what the supply chains look like, and how we could help. We then wanted to understand in terms of what we could offer, was there, you know, any validity to these products? Could we actually get them into the hands of the people who need them, and would they do their job? We then started to look at scaling production. Okay, we have some really solid candidate products. How do we then scale those locally? We were really looking locally. We weren't looking to solve the global problem. We were quite thrilled to see open source medical supplies and other groups that were taking the global view. We really took a hyper-local and geographic view. So once we started scaling our production, we really wanted to look at the business model and validate that. What are some of the risks in that model? And I'll talk you through that. And then kind of part 5, you know, what's next? Do we spin it out? Do we grow it internally? I like the worker-owned co-op model, or does it die? You know, I think all of us would like to be through this pandemic. So let's take a quick look at product research. Early on, one of the ways that we thought we could understand what's in the market and how we could contribute was we did a lot of reverse engineering. We took a lot of the stuff that we could get our hands on and we sort of pulled it apart, looked at what's in it. We're amazed to find that, you know, garbage ties were inside of some of the surgical masks and things like that. So we were like, okay, well, what do we need to do in terms of tooling to be able to then produce a reasonable PPE that passed some tests? We did a lot of exploration with materials, different types of geotextiles and other candidate products that were made from spun-bound polypropylene and polyethylene material. And then, of course, what we had to do was a lot of custom tooling. We built a lot of rigs and jigs and other kinds of tools that would help us scale up, essentially manual production of PPE. And that is one of the risks, as a lot of you will know, in entering the market, is it's highly mechanized, and scaling up when we're reliant on principally manual forms of labor is a real challenge. So testing the market validity, we learned quickly that there were 2 ways that we could help. One was producing shields, thanks to the teams that I've mentioned, Nick Lal, He's one of our members who really dove deep in looking at how can we create a shield that has a longer life than the disposable shields. And so he came up with a really elegant, reusable, autoclavable shield design. And then isolation gowns turned out to be something that we could really get into the hands of healthcare workers, thanks to Boston Medical Center and others who worked with us early on to develop a really strong prototype. Along the way, we came up with a lot of designs, as others of you have done. We wanted to make sure that the broader maker movement could benefit from this in-house R&D, if you will. So we made all of the plans for the shields and the gowns available. Some of the key findings that we had, was that we could produce PPE for non-clinical settings, right, to free up that critical supply upstream to the hospitals and ICUs. So looking at dental offices, looking at retirement homes, a lot of places where, a rated gown, a level 3 or level 2 wasn't going to be as critical. And so we were able to make a lot of relationships locally to get shields and gowns into their hands. We then had to, sorry, I jumped over, but in terms of scaling up production, we then had to convert our makerspace. We were essentially closed. I'm sure like a lot of you during this pandemic, we couldn't responsibly sort of serve our members and stay open. So we closed, but we were able to convert, as you can see here, our computer lab, for example, into a pretty clean room for the production of face shields.
Lars, 1 minute, and I want to get to sustainability.
Okay, great. I'll jump ahead. And likewise, we converted our fiber arts area. Big pain point, distribution. We could talk forever about how to distribute that. So in terms of scaling productions, we were able to go from about 50 gowns to 500 a day, which was substantial for us, from 100 shields to about 900 a day. We had about $60,000 in income. We were trying to sell these to then be able to bank our costs on the back end. For all of our products, we got to a point of about $3.33 per unit, which was good. To go forward, we realized that there were some real risks in our business model. One was the coordination costs. We couldn't do this as an all volunteer effort, and we couldn't take it out of our overhead. The second thing was just the availability of material. The market was so dynamic. One day there'd be a lot of one product, and then 2 days later it would be gone. So you really had to jump on materials when they became available. And then there was just really uncertain demand. We didn't know when the big supply chains were going to come online, and we didn't know, whether what we were making was going to pass muster and be in demand.
0 minutes, so wrap up.
Okay, so we created a partnership with Harvard University, the city of Boston. We're now using a Tyvek material, which is rated at level 3. We got our seams tested, which is great. And we're really studying, basically, we've gone from pop-up to a small business that is grant funded right now. We're working with the city of Boston, employing formerly incarcerated folks and new Americans to really work with our community, create a sustainable business and employment opportunity, and continue to get a really high quality product on the market. We don't know where this is going to take us, but we've got until about September 30th to come up with a valid business model that we hope can introduce, again, small quantities of a high quality product in some of the most stressed regions that don't have access to the big supply chains. So we'll see where that goes. Next step, we want to validate this model, and we really want to study our options. And thanks for the ultrasonic bonder, Neil. It's a game changer.
Glad you, this is a great lead into what I'm going to conclude. This was an unused tool in the CBA shop that Lars and colleagues took over and are putting to great use. So we had a group from XPRIZE in the last bit. They had a medical emergency from the pandemic, unfortunately, and I hope they're okay, to talk about $1 million next gen mass prize from XPRIZE. But we're almost out of time. We won't be able to get to the remaining questions in the chat, but almost everything presented today is open. So after the meeting, we're going to post links to everything you heard, starting with the coordinating work groups that were mentioned that are links of links into everything you've heard. And most of the questions in the chat are answered there. So the pandemic has been a remarkable collaboration. This morning has been a tour through people who didn't think they needed to talk to each other, didn't think were relevant, didn't think would answer each other. And over, we find not only could you talk to each other, but you needed to talk to each other. Just this remarkable collaborations that come out of that. I think that was really unexpected. And writ large, something similar is happening with whole societies, where Fab Labs go from an odd thing to that's a nice thing to that's an essential thing. And that transition has a number of implications for where we are in the evolution of what we're doing. And so the challenge now is really to continue meeting the immediate needs of the pandemic, contribute in all the ways we've discussed to how you build back from it. And the coming days this week are going to look, just from COVID in particular, to communities and economies and society, these larger questions, to really unpack what I think is the remarkable implications of the work this morning. And so, with apologies all to the high-speed rush, I think that was a great tour, and I'd like to applaud everybody, not just for what they said today, but for the work you're doing. And so with that, I want to thank everybody, and we get a bio break. Okay.
Okay, John. We are live. Hello, world. This is Fab Labs live from Boston. And we are about to do our annual tradition, which is called Fabercise. This was started many years ago by Frosty in Iceland, and it has followed us around the world, and we do this every day. So we're all suffering from at least 2 hours of digital fatigue. And I invite you now to kind of get your blood flowing and your energy back up by participating in Fabercise. And today's Fabercise is brought to you by the Fab Foundation team. And we want to do a special shout out to Francisco, who really thought about this, had the great idea, and is bringing it to us. So everybody, get ready, take a deep breath, and let's launch into Fabercise. So thank you, Neil, and thank you, Fab Foundation team, for putting together that really fun hands-on exercise. So everybody, for those of you who don't know me, I'm Sherry Lassiter, and I'm with the Fab Foundation, and we are so proud to and excited to co-host this first all virtual FABX conference. So it's really heartening to see you all. It's exciting after being sort of shut up for 4 months. And I'm extraordinarily excited about all the countries, about everyone from, I see people from South Africa, from Brazil, from the Philippines, from Bali, the Netherlands, Iceland, Czech Republic. It's Japan, New Zealand. It's just amazing. So thank you all for putting aside your digital fatigue, putting aside your COVID fatigue, and joining us for this amazing week. I think I'd like to just back up 1 second and say thank you to this morning's speakers. It was extraordinary, the work that you are doing and that you will be doing and that you continue to do. And it's just the tip of the iceberg, really, of the great work that's happening across the world. As Roberto said a little earlier, this shows the power of the people. And the network is showing the world what we are capable of. And so we have 5 days ahead of us that are going to be terrific in terms of the content and sharing what we've all done and sort of mapping the course forward. So the one thing I did want to say, though, is this: we didn't do this by ourselves. This is your conference. You have contributed all of the workshops, all of the activities, and the talks. And it's an exciting moment. It's very different for all of us, but it points to a path forward for these annual meetings. These are better for the planet. They're less expensive. They're more, they're more inclusive in terms of, how the content is created. And, I have to say, it's just taken an amazing team of people to really make this happen. So to bring this conference to you, I'd like to thank the core team. So we have Narella, who has been production managing, Francisco, who has done an extraordinary job with the back-end technology. We have Anastasia, who has brought all the workshops and, sort of masterminding all the activities. Rebecca, who has just made this all work. And then we have Victor, and we have Christian, and we have Sarah, and we have Marie, who have all put this together for you. And so we want to thank you all so much for making this happen. We'd also like to thank all of the volunteers. We have lots of volunteers this year who are, working in the Zoom rooms with you and supporting the conference in many ways. And so thank you to that amazing staff. We couldn't have done this without you. And so I think that we want to talk just a moment about our workshops and the daily schedule. So as you saw in the morning, we will do these 2-hour sessions followed by Fab World, which is what we're doing now. And Fab World is when you check in on, what's happening in the network. What are the great new projects and challenges that we want to share amongst ourselves. And so, but that will be followed in the afternoon between Eastern time, 1 to 3 p.m. for the most part, workshops. And so we've got 8 activities today lined up for the afternoon. And then we also, following up, we have different activities happening in different parts of the world on your own time frame. And so just in addition to the 8 workshops that are, sort of happening here, there are workshops happening all over the world, and they'll be happening at all times of day in your own time zone. So watch, like in the mornings, our time, very early mornings, there'll be activities happening in Europe and in Asia and across the world. And it's wonderful content. Everything is recorded and will be online for you to see later if you don't get a chance to do it now, right? So, then with that being said, I would like to turn to the first award, which is the Forest Award. And this is for the challenge that they have brought to the network in the last few months. But just as background, John Martinsik is going to announce the award. John is the president of Forest Scientific, and he is a tremendous partner and has been a tremendous partner for many, many years. I've seen him in South Africa when he's there promoting and installing his machines. He's been in Kenya. He's been all around the world with Fab, and he's been such a good partner and done such good work. He even has named one of his machines after the community, the Fab Bot, which is a CNC machine. And with that, Martin, John, I'd love to turn it over to you to talk a little bit about your thoughts about why you posed this particular challenge and to announce the winner. So John, please take it away.
Okay. Am I coming through? Okay, great. This was something that Sarah and I were discussing. What would be a great challenge? What would be a great entrepreneurial challenge? And I had just been driving through the San Francisco area, and then I was down in the Phoenix area, and I noticed a lot of homeless people. And we were talking about how many problems there were with their abilities with COVID and the here's some background things coming through here in just a second, and the as well as the Navajo Nation, and we were talking about their issues, and they're having such large amounts of COVID, and a big part of it is because there are so many people without running water. And you know, the typical American would never think of there being challenges with having running water to even be able to wash your hands, because it's something that most of us take for granted. However, as I've traveled and as Sarah was working with the Navajo Nation in New Mexico and Arizona, we both came really to the same conclusion that something needs to be done to address these needs. And so that's why we came up with this particular challenge. And it's something that is definitely needed in Africa. It's definitely needed all around the world. There is a great deal of homelessness and the lack of water to be able to wash hands, just having the fixtures and so forth to do so. So this year's winner, we had some really great entries. And I want to talk about a few of them before we announce the actual winner. I really liked the one from the Philippines initially, and it was almost identical to what I had thought of as far as the basic concept of how it worked. And I thought, oh wow, this is great. And then as I kept going through them, they all had great advantages. The entry that came from Brazil, it was a Rolls Royce. It was incredible, just gorgeous to look at. The reason it's not chosen as the winner is I didn't feel it was as practical for harsh conditions. I think it'd be great inside, and the workmanship was just absolutely incredible. It's a Rolls Royce of hand washing stations, but I didn't feel it was as good for the outdoor on a city street or out on a reservation. The winner is the Vigyam Ashram in Pune, India. And it was the most practical. I felt that it would be very inexpensive to build and duplicate. It had a very high capacity where some of them would only relatively be able to wash a couple of people's hands and need restocked, and to be able to be unattended. This one, I think the estimate was to be able to wash at least 160 people's hands. And so it had a great capacity, and I believe they even have it set up so that it could alert somebody when it needs more water through a cell phone. And so I felt that it was the most practical, very inexpensive to build, and and duplicate, and something that could be shared around the world and at a very low cost. It had probably the least amount of fabrication compared to some of the other ones that were beautiful works of art from a cabinet standpoint. But from a standpoint of getting the job across and providing water to those that need it, I thought it was just amazing. And then we have a second award. I didn't know if you have a different slide for that, or, okay, so now I see the slide for India, and here's the unit. Again, very simple design, but it gets it done. And sometimes it's not how complicated we make things. As engineers, sometimes we overcomplicate things. I'm very guilty of that myself. This was just so simple that it made perfect sense. And then the other award, this one was unannounced. This is not a competition. This is something that I've decided to do because of conversations that I had with Kyle Pierre of the Garage Fab Lab in Michigan City, Indiana. And he has began an incredible work for providing homes for the homeless and building them on a CNC and make very inexpensive housing for the homeless. And so it was related to this competition, but not the same. He also entered for the hand washing station. However, I felt that he really deserved an additional machine to help him with his great work in Michigan City for the homeless. And that's one of the things that I love about the Fab Network, is that so many things are being done for humanity, so much great help. From Field Ready's projects after a disaster to the things that are invented every day. And I think that that's, you know, a great purpose, to be able to help people, help mankind, whether by making something fun and easy to use to things like these that actually save people's lives. Thank you for the opportunity to be on here today.
Thank you, John. Congratulations to Vigyan Ashram and to Garage Academy. And John and Forrest, thank you so much for your continued support. It means so much to us. So now we're going to move to a fun exercise that we do every year as well. We have pitches for future FABX conferences. And so just a note here to say that we are so sorry that we're not in Montreal this year, but we'll be back next year. And we're planning for the years ahead. And to talk about these pitches and FABX, we have Narella. Narella is the sort of FABX guru of the network. And so Narella, take it away. Let's talk about pitches.
Thank you, Laz. Yeah, basically every year we have this sort of healthy competition where we are as inclusive as we can to make Fab Labs available to host the FABX conference. This year, if you want to call it like that, we took it like it just flew to Fab Foundation, then we need to fly it back to Montreal. But we always have the opportunity. So this year, we are going to have 2 rounds of pitches, just so everybody knows. Today, we will have 1, and on Wednesday, we will have the next round of pitches. And for today, we have 2 wonderful videos made from 2 different locations around the world that we'll be pitching for Fab 2024. So stay tuned for that. We will definitely on Wednesday add a poll on our platform or on FABxMembers.FabEvent.org platform for you to vote on which one you want to go for 2024. So with further ado, let's go first with the Czech Republic, and then we will follow up with a video from Armenia.
Thank you. It's nice to see that some fine things made it through the COVID pandemic. Now, thanks to wonderful people like you, the egos of moderators like me won't starve to death. You're a wonderful audience, one of the best I've had lately, so it's my pleasure to share with you a hot piece of news. One of the candidates for Fab 2024 is the Czech Republic. That's right, the Czech Republic, a small country with huge talents and even bigger ambitions. There's so much I could talk about, let's take a look. First off, safety. There's literally nothing to be afraid of here. The Czech Republic is the 10th safest country in the world. And that's really saying a lot when democracy has only been here for 30 years. You know, but even before that freedom came along, the Czechs were already making a name for themselves. This skillful nation has a long tradition of craftsmanship with numerous inventions and discoveries. One of those, for instance, is the word robot, so common today, but it actually started here. And another, maybe even more interesting, is that this was the birthplace of Pilsner beer. And a half-liter sample of the stuff at a local pub only costs you 0.0001 Bitcoin. I know, right? Amazing. The Czechs are devoted, passionate workers, and it's been amazing watching the maker community come together to fight the coronavirus pandemic. But actually, let's hear about that more directly from them.
Hi everyone, thanks for the invite, Kyle. Here in Prusa, we managed to print over 200,000 face shields and distribute them all around the Czech Republic. And in the spirit of sharing is caring, we decided to share them as open source design for the whole world to use. The Czech run for Fab 2024 is exciting for our entire maker community, because with it, the number of labs can grow from 3 to at least 20. But we are not alone there. The Fab family is supported by a number of Czech companies, universities and institutes. And their government guys will definitely tell you more about all this.
That's probably true. Let's hear from them.
Hello everyone. The government initiative and strategy Country for the Future Czech Republic officially support the maker community and Fab 2024. It's in the interest of our entire nation to help makers and our future lies in innovation. Czech Republic is creative culture country.
Good point. Next.
Hello everyone. Fab 2024 in the Czech Republic is a milestone for the entire Central and Eastern European makers community, as it's gonna be held there for the very first time. What a great opportunity to tear down the barriers between the West and the East.
Thank you, Tomáš. For all this amazing support, we would like to really thank and big up to everyone from the maker community, Fab Labs, and also our organizational team, who is really looking forward to having you here. So, see you then.
Fantastic. Thank you guys so much for all the work you do for the Fab family. I'm sure it's going to be an amazing ride with super packed program and a lot of one-of-a-kind meetups and the unique opportunity to high-five Josef Prusa right in his maker factory. Yeah, maybe rather wait until Fab 2024 live and in the Czech Republic. So now, it's time to check out our website and leave us your personal information. In exchange, you'll be put on our wall of supporters for everyone to see, and you'll also receive lots of invitations to really interesting pre-events. See you in 2024. Not again. Figures.
Armenia is an undiscovered gem of the technological world. In Armenia, you will find technology and nature work in harmony. Our aspiration is to empower everyone to create, innovate, and share their knowledge with the world.
Armenia will become a gateway for local and global communities and a framework to promote collaborative action to solve global challenges.
All right. Well, everyone, so that was pretty cool. Like, do we want to go to the home of Pilsner and robots and Prusa, or do we want to go to the very exotic Jilesen in Armenia, where it looks like it's a lot of fun and absolutely beautiful? So now watch out, because for the coming few days, we'll have a few more candidates who will pitch in the mornings, and you'll have to vote. So I think starting on Wednesday, you'll be able to vote on where you think we ought to be in 2024. Now I think we'd like to turn to a very cool activity. Anastasia, who has sort of engineered all of the activities around the world for us this week, was also she had this great idea for a challenge, and so she's going to explain and talk to us about the challenge and honor some of the people who have worked with us over the years. Thanks.
Hello, Sherry, and hello, everyone. We are very happy to launch today the Social Distancing Challenge. So it is a fun challenge. It's more speculative. It's actually a way that you can create literal physical distance between each other. So we want fun projects. We want your contributions. You can still try to go to your labs, or you can make at home any kind of ideas. And then we are giving out 3 brother sewing machines that they are a contribution from Fab Foundation. And we will be posting, so we want you to post all your ideas on our social platform under the topic Social Challenge, Social Distancing Challenge. And then we have a community-based jury from our ambassadors that they will choose the final winner to announce on Friday. So there is not so much time, get going, and tomorrow morning we will check in. We have a session for half an hour so that we can talk and mentor your ideas. There is not only this challenge. If you go under topics on our community platform, then you will see 2 more challenges. One is the Make-a-thon from Makers for Good and from Wikifactory, and the other is the Symbio Creation Challenge, which is a different kind of competition where there is no only one winner, but everybody wins. So look at our challenges. This is the last week that you want to make a lot of crazy ideas reality. Passing on to the next subject, we would like to talk about this year's conference and all of the things that happened this year, we would like to dedicate the conference to our beloved friend and the plumber of the Fab Lab Network, Fiore Basile. We have created for him a special webpage, and we invite Claudia Simonelli, his partner, to talk about that. Hello, Claudia.
Hi, everybody. Let me screen share it. Yeah, so BitNinja is up. This is the website we have been developing in memory of Fiore. First of all, I would love to thank Julian Gallimore and all other people from the Fab Lab Network who really contribute to this idea. We basically want to invite you all to share a memory on this page. That it's basically a website, but also a platform where you could post pictures as well as thoughts and messages in memory of Fiore. Aside of this, you will find here a bit of his story, as well as his personal projects, and something about the next initiatives like memorial services that we have in the coming years. Before playing this video, that's a teaser that Rico Cantata made, and it's an apology of Fiore. I would like to remind you all that here we find the other website that we made for Fiore last year. It's Fiore Basile FABx scholarships that it's made basically for supporting and getting funds for supporting academic and students graduation for next year happening in Montreal. So here you have the button for the website, and I just go through here and guide you how to upload the memory. So you find the button. It's a matter of 3 steps. You can just select a picture or just write a message. You can do here by your computer or either by your phone. You can leave a message. You will get the preview real time, as well as the preview and the post happened on the landing page. You can add your name, location, and year. As soon as you upload it, you will find it here. Last but not least, the wall is moderated in the backend, so please try to keep 2 posts maximum per person. And now we will see the video.
Fiore.
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 Fiore! Where are you?
My dear Italian friend.
Fiore was my mentor.
He's an amazing guru.
Fiore was a phenomenal teacher and an extremely positive person who made everyone around him put a smile on their face.
And goofy sometimes.
I don't need to describe how amazing he was because everybody who met him knew it.
Is his boundless passion.
He was also a great friend to everybody, always happy and cheerful. Like I would say, like he's like a Fab Lab rock star.
He was always super, like trying to help everyone around him.
A really inspiring person.
You became a pillar of the community.
And it seemed that we had known each other for life.
His departure left the world a little bit more gray than it was before that. And I miss you, man.
I really miss you.
I don't have any words to tell you how much I'm going to miss Fiore.
I miss you, man.
I miss him.
I really miss the guy.
Yeah, I know. Me too.
We follow your steps, spreading knowledge and the network of the Fab Labs.
Wherever you are, we remember you.
Thank you for all the things you've brought to this world.
Thank you very much, compa.
I love you so much.
Therefore, he will always live with us in our memories.
Fiore, take with you our tenderness, our admiration, and our love. We will never forget you.
I'm just sad because it's going to be 10 times harder and half as fun without him.
Rest in peace, Fiore.
Rest in peace.
Thank you so much for that absolutely beautiful memorial. Thank you, Claudia. Thank you, Rico from Kamakura, and also Julian Gallimore for the website. You know, we really appreciate it. Fiore's memory lives on and his legacy lives on, so thank you. And so now it's time to start our activities. But the first thing we want to do is from 12 to 12:30, we have our sponsors, our sponsor sessions. And each one of our sponsors today, which would include Chevron, it would include Brother and Forest. All three have great content for you online. So please go and join one of our collaborator sessions now and learn from the best. And then join us at 1 o'clock or in about an hour as we start our activities for the afternoon. And again, thank you so much to the community for participating and for bringing these amazing activities to us. So now, this is our first time doing an online conference, and we are so thrilled to bring this to you, but it does cost a little bit of money. And so I would pitch here for you to please, if you have the wherewithal during these strange times and these difficult times, but if you like the conference and if you would like to help us, please contribute. You can donate through PayPal, and we would appreciate every little penny, every drop, every dollar, every euro. So please donate if you can. And we will see you later today in the workshops, first in the sponsor sessions and the workshops. Stick with us because it's going to be very, very interesting and lots of really great conversations. And we will see you tomorrow morning for supporting communities, community action at the same time, but it will be preceded probably by a few workshops as well. So check your schedule regularly and often, and enjoy the afternoon, enjoy the day, and we will see you in the morning. Thanks so much.